According to the National Cancer Institute, so far this year, nearly 110,000 people have been diagnosed with colon cancer, and nearly 50,000 have already lost their lives. Derrick Williams, a naturopathic doctor, works to help others lower the risk of getting colon cancer through a process called colonics or colon therapy.
We're addressing the large intestine. The large intestine is approximately 5 feet long and it holds 4 days of waste. And that's the area of the intestines where all the organs absorb their nutrition from. So we have to remove the toxic waste out of there and cleanse that out so the body can get hydrated and detoxified at the same time. So right here is the speculum, or the scope, we call it. And these are very small scopes, not real big at all. So we're going to take this, and this is your rectum, and so we insert the scope into the rectum, okay, at the back stop there, and we pull the ovulator out, okay. After the ovulator is out, then we take the waste hose and we hook up the waste hose to the scope, like so. This other hose here is the water feed-in. So you have the water going in and the waste coming out. We got the scope into the rectum here, and we gently put water in and release it. The water and waste comes out. Gently put more water in, release it, water, waste, gas, and all the toxins and parasites out. The objective of the colonic is to get the water all the way around to the cecum. The large intestine is 5 feet long, as I mentioned earlier, and this is where all your major organs absorb nutrition from. So it's very vital to cleanse it. We need to cleanse it on a regular basis, just like we brush our teeth every day and take a bath every day. We need to cleanse the colon regularly.
Williams says our diet is the main cause of illness and disease and should be the starting point when it comes to getting the body back on track.
So my lifestyle is pretty different, you know. So, you know, I'm not doing the pancakes and eggs in the morning. I'm not doing the ham sandwich and french fries for lunch.
Instead, Williams eats mainly plant-based foods, fruits and vegetables, no animal products, and rarely anything cooked or processed.
Most of the so-called diseases, which are just symptoms, high blood pressure, diabetes, and so forth and so on, those are all just dietary illnesses. They are all just diseases of the fork. And so we can get well just changing the diet. The diet made you sick, so the diet can get you well.
A change in eating habits helped him drop a significant amount of weight. Here you can see the before and after. And Beth Turry, one of Williams' patients, did the very same.
I have lost 45 pounds. And my cholesterol is down, and and significantly, my sugar levels have come down. Eating raw foods and not eating any processed foods, not eating meat or dairy, and drinking lots of water, and colonic therapy. I'm on no medication. I'm on none whatsoever.
Williams' eating routine consists of drinking a glass of room temperature water in the morning, a quart of fresh vegetable or fruit juice, and coconut water throughout the day. For substance, he'll eat mostly soft foods, a salad, or sometimes a meat substitute.
We want to eat 85 to 90% of the food uncooked, unprocessed, unadulterated. So just apple for apple, lettuce for lettuce, watermelon for watermelon. You know, well, you have fat that heal and then you have fat that kill. So my diet has fat in it, but it's the good fat. Your polysaturated and your monosaturated fats, those are the good fats. So coconut is a fat. Okay. Nuts are fat. Avocados are fat. Olives, those are fats. Those are all my good sources.
Williams' wellness program is complex, requires guidance and consistency. But at the end of the day, will help the body not only perform at its best, but be at its best.
The body is just really saying it needs nourishment. That makes me feel good, you know, to know that I can help people come out of death clutches back to life.
Reporting for the Science and Nutrition class, I'm Damon Maloney.